Another Victory Lap story that we need to focus on for today.
It's the Victory Lap on the O Factor.
I think so very few times do we get to hear of really incredible success stories when we're talking about just the battle with cancer. Firstly, I don't know if it's the era in which we're living in, but the prevalence of cancer throughout all aspects of society, across the different age groups, the different genders, the different racial stereotypes. There is no person that you can put a name on and say this is the face of cancer. That's because it's just been so ravaging and become so prevalent. I've lost a few friends who are in their 30s to cancer. So it's so good to be able to have a conversation with somebody that has managed to collaborate public and private partnerships to be able to create a sustainable model for delivering quality healthcare, and really, especially in oncology, and how these innovative approaches can be replicated to address healthcare challenges across the country. Dr. Marais, who is a Chief Operations Officer at the Icon Oncology and also Managing Director at the Johnson Rose Cancer Foundation. Dr. Marais, we are so excited to have you on Heart FM this morning. Good morning.
Morning, Olwethu. Thank you for having me.
Oh, I'm so excited. I mean, it's just, there's so many different stories that you hear, and very rarely do we hear of successful private and public sector partnerships. Can you maybe start at the very beginning, Dr. Marais, the vision behind Icon Oncology and its approach to value-based care in the treatment of cancer?
Yeah, so Icon Oncology is mainly serving the private population in South Africa, but I think from our inception, it has always been part of our vision to provide access to cancer treatment for all South Africans. I think, as you know, the disparity between the private sector and the public sector in South Africa is massive. We only have about 9 million people in South Africa that can afford medical aid.
Sure.
And that leaves 54 million people that have to rely on the public sector. And even though the public sector does great work, it is really resource constrained. And there's about 80% of the oncologists in South Africa work in the private sector, and only about 20% in the public sector. Sure. So we have been aware of gaps in access to cancer treatment across the country. But specifically, what came onto our radar was Kimberley. Now, and access to care in the Northern Cape. So cancer treatment, I just have to say, is very much a multidisciplinary approach. So there are lots of doctors involved and other healthcare providers. So we're looking at surgeons, oncologists, palliative care doctors, and the approach really has to be multidisciplinary. But if one of those sectors do not function well, then we've got a problem. And then radiotherapy, access to radiotherapy in cancer treatment is a big issue across the country. And there was no radiotherapy facility in Kimberley, and patients from the Northern Cape had to be consulted at the Kimberley State Hospital, but could not receive their radiotherapy there, and they had to make a further journey to Bloemfontein.
Wow.
So we collaborated with Robert Mangaliso Sobukwe Hospital, which is the name of the state hospital there, with their management and with the Northern Cape Department of Health, to see if we can't solve this problem if we put our heads together. We have a private radiotherapy facility in Kimberley, and we did have capacity on that machine. So this is, I think, a very good example of when people work together and apply their minds to solve problems collaboratively, that you can do that. So with the oncology department at the Kimberley Hospital, we have given access to those patients to receive treatment in Kimberley.
Wow.
This process has been ongoing for about 5 years. We've treated over 500 patients. We are providing transport for patients from across the province. We've worked with the hospital to set up accommodation, because radiotherapy treatment can last up to 6 weeks. So patients are receiving the accommodation, and they can have their treatment in the private facility. The government oncologists are overseeing this treatment, but it's been really, really successful. doing this at cutthroat prices as well for the state to make sure that it remains affordable. And we're really seeing the benefit of this, and these are people that maybe would not have had access to care are now getting their radiotherapy, and it's a
Dr. Marais, I don't think it's a maybe. They definitely would not be able to get access to the radio care. If you look at the queues in public hospitals, just even the casualty ward, before they get admitted into the specialist wards, it's just waiting and waiting and waiting. And once you're in there to say that the treatment that you need, we don't have it here. I mean, the work, this collaboration, being able to have logistical support, technological integration, and share your expertise is really just phenomenal. And it's something that we can't not applaud. It's really literally changing lives and impacting, I don't know, generations of that. You know, there's a mom that you're treating today that's got her kids back at home who are waiting for her to come back feeling better. And this collaboration allows for that. In the light of ongoing discussions about the NHI, how do you think collaborations like the ones that you have in the Northern Cape can inform and maybe shape the future of healthcare delivery in the country?
Yeah, so I think that, healthcare is very complex. And, the universal health coverage is what everyone in the country wants. And it's really closing the gap between what's available, the access that people have in the private sector versus the access that people have in the public sector.
Yeah.
I think the NHI is probably not going to solve that problem in its current form. But we mustn't be daunted by the enormity of the task of providing good healthcare to all South Africans. And what we're doing here is, one step at a time, one patient at a time, giving them access to care by good collaboration. The private sector is not without its problems. It's very expensive. Cancer treatment is very expensive. But I think what we're illustrating here is if you work together, we can take the expertise that sits in the government sector and expertise that sits in the private sector, combine it to the benefit of patients.
And looking forward, what are your hopes and plans for expanding access to quality cancer care? And how can other healthcare providers and policymakers just contribute to this bigger mission?
Yeah, I think that this is a very good example of how you work well. And if we can duplicate this in other provinces and other facilities, then I think this is a very good working model going forward. The private sector, as I said, that will never replace the public sector, but it can really augment it. But we need to open our minds on both sides of the spectrum and really look to collaboratively solve problems.
Dr. Marais, we appreciate you for your time, your wealth of experience over 12 years in building and managing healthcare networks. We truly want to applaud you and encourage you to continue the work that you're doing. You're changing so many lives. And like you said, it's not without its complications, but I think with your determination and access to other resources and other collaborations, you continue to do great work. We appreciate you, all right?
Thank you very much.
Oh, that is the incredible Dr. Marais, who is the COO at Icon Oncology and Managing Director at Johnson Rose Cancer Foundation. What a phenomenal human being. 12 years of experience in building and managing healthcare networks. His partnership with the Northern Cape Hospital has seen thousands and thousands of cancer patients be able to receive a radiology treatment in a private unit, in private hospital through collaboration with private and public sector. This is what it should look like, eh? This is what it should look like, where we're 20% of oncology only sits in public hospitals. The balance sits in private. How do we make that balance? Well, that's how you do it, through this example and story of Dr. Marais. What a beautiful victory lap.
My wife is just incredible. She knows just